Here we have the anterior side of the heart. Going in the direction of blood flow into the heart, the blood will come in through the superior vena cava and the inferior vena cava. So superior and inferior vena cava, this is the right atrium here. This is the right ventricle. So in through the vena cava, into the right atrium, into the right ventricle, and then out the pulmonary trunk, out the pulmonary arteries. Next, we have blood will flow back in. It'll come in through these pulmonary veins, going into the left atrium. So we have right atrium, right ventricle, vena cava, pulmonary trunk, pulmonary arteries, pulmonary veins, into the left atrium. From there, they go into left ventricle. From left ventricle, they pump out aorta. Here we have brachiocephalic trunk, left common carotid, left subclavian. Those are the three branches coming off of the aortic arch, ascending aorta, aortic arch, descending aorta. Tucked in behind this pulmonary trunk there, you're going to find the, let me make sure. You'll find the left coronary artery. It's going to come out this way. I might get a better heart model for this one. Okay, so left coronary artery is tucked in back there. It'll split into two parts. Down here is the anterior interventricular artery, and then going around the side of the heart is the circumflex artery. On this side, you have the right coronary artery. So right coronary artery, left coronary artery back there will split into anterior interventricular and circumflex. In terms of veins, on the front here, running right next to the anterior interventricular artery, you'll have great cardiac vein. On the posterior side, you're going to have the middle cardiac vein, right next to and inferior to this inferior vena cava. And then you're also going to have the coronary sinus. That's the part of the vein that will empty into the right atrium. So all the blood collected from the heart, deoxygenated, goes into this coronary sinus, into the right atrium. I believe that's all the external stuff. We could open it up now.